Welcome to The Explainer. Today, we are diving into some of the most common and, honestly, most misunderstood digestive issues out there. We're actually going to take a little journey down the GI tract to figure out what is really going on inside when things start to feel, well, off.
You know that feeling, right? That familiar burning sensation right in your chest that we call heartburn. But what is it actually? Is it just a minor annoyance you get from that extra slice of pizza, or could it be a sign of something more? To really get it, we've got to look inside. So let's do it. We're going to travel from the top down, starting with the esophagus, then into the stomach, and a little bit beyond. And at each stop, we're going to look at what can go wrong, why it happens, and, this is the important part, what it means for your health in the long run. So let's get started.
Okay, our first stop is the esophagus. That's the muscular tube that connects your throat to your stomach. And this is pretty much ground zero for one of the most common GI complaints you hear about: reflux.
You've probably heard the acronym GERD before. It stands for gastroesophageal reflux disease, and it's exactly what happens when that super strong stomach acid decides to travel the wrong way, back up into the esophagus. The thing is, your esophageal lining, it just isn't built to handle that kind of acid, and the irritation it causes, that's what we feel as heartburn.
Now, here's the good news. A lot of the time, managing GERD really just comes down to some pretty simple lifestyle changes. It's all about working with gravity instead of against it. Seriously, simple habits like just staying upright after you eat, propping up the head of your bed a bit, and not eating right before you lie down, they can be incredibly powerful. And of course, we have to talk about diet. Certain foods are just classic culprits. We're talking spicy dishes, caffeine, those fizzy drinks. They either make your stomach produce more acid, or they can relax the little valve that's supposed to keep all that acid where it belongs, making reflux way more likely. But what if you're trying to manage your diet, you're changing your habits, and it's still not enough? Well, sometimes the problem isn't just about acid, it's actually structural. A hiatal hernia is when part of your stomach pushes up through your diaphragm. The most common kind is a sliding hernia, and you can often manage that just like you would GERD. But the second type is a bigger deal. That's where the stomach bulges next to the esophagus, creating a risk of blockage that almost always needs surgery to fix.
All right, let's head a little further down the track to our next stop, the stomach itself. This is where we run into two conditions that can sound really similar but are actually critically different: gastritis and ulcers.
So here is the key difference, and it's actually pretty simple. Think of gastritis like a widespread irritation all across the surface of your stomach. The whole lining's just raw and inflamed. A peptic ulcer, on the other hand, is totally different. It's a deep, focused sore, an actual hole that is worn through that protective lining.
Now this is fascinating. It turns out that when you feel the pain can be a huge clue. If the ulcer is actually in your stomach, eating usually makes it hurt more because the food is literally pressing on that sore spot. But if the ulcer is just past the stomach, in the first part of the small intestine called the duodenum, food actually makes it feel better for a bit because it soaks up all that acid. It's a classic clue for doctors.
You know, for decades, we blamed pretty much all ulcers on stress and spicy food. And look, those things don't help. But we now know the #1 culprit is actually a bacterium called H. pylori. When it gets overgrown, it can just wreak havoc on the stomach's protective lining, which paves the way for both that widespread gastritis and those deep, painful ulcers.
So, this brings us to a really critical question. Why should we take stuff like reflux and gastritis so seriously? Well, because chronic, long-term inflammation is a known pathway to something much, much more dangerous.
This timeline really illustrates the long-term risk of untreated reflux perfectly. Think about it like a chain reaction. Years of acid splashing up and damaging the esophagus can cause the cells there to change. This is a condition called Barrett's esophagus. Now, these aren't cancer cells yet, but they are precancerous. And if that irritation just keeps going, they can eventually turn malignant. And a very similar process can happen just one stop lower in the GI tract. That chronic gastritis, that constant nagging inflammation of the stomach lining, can also lead to cellular changes over time, increasing the risk of developing stomach cancer. And this is exactly why managing these conditions early on is so vital.
Okay, so with that understanding of the risks, let's try to put it all together. Let's build a practical toolkit of protective habits and, just as important, critical warning signs to help you protect your GI health. The goal here isn't about having a perfect diet. It's about building consistent habits. Simple changes, eating smaller meals, limiting triggers like alcohol or certain pain relievers, and finding healthy ways to manage stress all work together to protect that delicate GI lining. Okay, now this slide is crucial. These are not symptoms you wait and see about. Vomiting blood, stools that look black and tarry, or suddenly finding it hard to swallow, these are all signs of a serious problem, like a bleeding ulcer or even a potential malignancy. If you experience any of these, you have to see a doctor right away.
This quote from our source material really just says it all, doesn't it? The whole goal of understanding these conditions is proactive prevention. It's about recognizing the early signs and making those changes to stop the progression from simple inflammation to something far more serious. It's about nipping it in the bud. Ultimately, symptoms like heartburn aren't just annoyances, they're signals. It's your body trying to tell you something. And by learning to understand these signals, you can shift from just reacting to pain to proactively taking control of your digestive health for the long run.